Welcome to episode 285 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs and Security First IT. Joining me is Donna Grindle of Carden. Good morning, Donna.
Good morning, David.
How are you?
Yeah, getting close to feeling like I can get in control again.
Are you really?
Yeah, close.
It won't
But
last long.
it's probably just a fluke.
Mm-hmm.
When you have a really productive day and you get a lot of stuff off your list and you feel really good
Yeah.
until you look at the list after you're done. And I got to check everything off, but didn't look at what was left. Kind of gave myself a break from seeing what was actually there.
Yeah. It's good to have your list broken up so you don't see the whole list.
Yeah.
Otherwise, you get that overwhelming feeling of, oh my gosh, I can't get anything done.
That's why I have like 5 lists, 6 lists.
Mm-hmm.
It works better that way.
But I don't know about you, I'll start my day and like, these are the 3 things I want to get done. And at the end of the day, I got one done.
I try to every day say, okay, you can't go to bed until you get this one thing done.
Mm-hmm.
Right. And there I am at 1:00 in the morning. I'm not going to bed till I get this done.
How many times now, I don't know if it's happened to you, but it happens to me. I'm sitting there typing and I'll wake up and there's like a whole page of the same letter.
I'll wake up and my hands are on the keyboard and my head's over and just kind of drooling a little bit.
Yep. So I guess as we go through the show notes, if you see stuff like that, if you see a whole sentence of the same letter, you know what happened. Oh, funny stuff. So in today's episode, we're going to be talking about cyber attacks, and they will be getting worse in 2021. And no, that's not our prediction. I think that's kind of a given. So we haven't done our predictions for 2021 yet, but
I'm afraid of that after our 2020s. So
why's that? Yeah. So we also have to go back and do an episode reviewing what we talked about as far as.
Well, that's why we replayed the 2020 predictions on Thanksgiving, kind of a refresher of what we thought was going to happen before it became the dumpster fire that it is. And it's an international dumpster fire, and you rarely get those.
Yeah.
Right?
I don't recall either of us landing on a pandemic. I don't think we even talked about election hacking, but maybe, I don't know.
No.
Because really, even that was kind of a safe bet.
Everything, no. Yeah. Anyway, so we'll have to have a Zen moment and figure out what we think is going to happen in 2021. But this we're going to talk about today, it's not like a guess. It's kind of like, okay, there's a rickety little bridge and you're going to drive a dump truck loaded with massive boulders over the rickety little bridge. What do you think is going to happen?
Yeah, it's kind of like one of those, breach conversations. It's not if it's going to happen, it's just how bad is it going to be?
Yep. So we're going to take you through why that is so obvious to us. And, I would love for us and a lot of people to be wrong.
Yeah.
I don't mind being wrong when it's this scary stuff, but
yeah, it does happen to me often, but all right. So for those of you who don't know, if you want to see our smiling faces, we are now on YouTube in real living color. So you can go to helpmewithhipaa.com/YouTube. It'll redirect you to our channel. We've always had the podcast there, but it's always been the audio version until recently. And now we have a video version of us recording the podcast, which is technically called a vodcast.
But look, we've got this down. We can high five.
I know. Right? Check it out. No. Was it this way? It was this way. I just got to get a.
I learned my way. You are the problem.
Yeah. I got to get a sound though, so I go.
Yeah, there you go. We got to work that out.
Yeah. So we'll get that. So we'll be doing some virtual high fives. We'll teach you how to use Zoom to do virtual high fives. because you know us. We gotta improve on stuff all the time.
Yeah. Yeah, it's us.
Oh, okay, it's me.
Yeah. And
You
it's
just go
not always
along.
improve. You just got to play with toys. That's
Well,
what it is.
with everybody getting Zoom burnout, I'm like, we got to find ways to make it more engaging. Let's figure out how to do high fives.
Yeah. I'm working on some stuff. We're going to set it up. We're going to be like we're sitting side by side. I got an idea, but not yet.
Yeah. Well, most people do the high fives straight at the screen.
Yeah.
Like, no, we're already beside each other. All I got to do is reach over.
All right, let's knock this out because there's a lot of stuff. We already cut things.
I know. We will.
And yeah.
All right. So we're going to dive right into it. Before we do, though, HIPAA Boot Camp Virtual Edition, February 23, 24, 25. Find out more about that at thehipaabootcamp.com. Better get signed up now. February will be here right after January.
At least we can count on that, right?
Yeah, we can count on that. Another thing we don't have to predict. I don't know, though. These days, maybe not. Who knows?
Yeah. We're going to make a big prediction. February comes after January. Yeah. We're good.
But after 2020, nobody's even willing to even say that. And I guess we need to tell everybody, make sure to listen to the last episode of 2020. It is our annual blooper show.
Yeah, because this is the last one of us doing normal stuff for 2020.
If we do anything normal.
And I have a shirt that says I'm not as normal as I first appear.
Yeah. So our blooper show, for those of you who don't know, we have an amazing editor that we've had almost since the beginning of the podcast years ago. And we turn him loose once a year because that's all we can take. We turn him loose once a year and we basically say, look, create a blooper show. It's all on you. Do what you want to do. And he's always done a fantastic job of pulling in a lot of this dumb stuff that you guys don't hear that gets edited out. He puts all that together. He MCs the whole thing. So he's from Croatia, so you get to hear his Croatian
thick accent.
Yeah. And on top of that, he tries to be like Santa Claus or something usually, but and he puts in sound effects and everything. He does a fantastic job. I think he enjoys it more than we do.
But he still complains. I love that.
Yep, absolutely.
Yeah, so that'll be on Christmas Day, and then you'll hear new stuff from us that we've already moved from this week to that show because there was too much to cover on January 1st, 2021.
Yep. All right, you ready? Ready to get into it? Let's do it.
Let's do it.
All right, now for the HIPAA. Oh, hit too many buttons right there. All right, so the HIPAA say what episode? Yeah, it's 2020. HIPAA say what?
Okay.
So I was a little shocked because you don't see this very often, but in my inbox yesterday, there might be some changes to HIPAA coming.
Well, we talked about this a couple of times. In fact, often we've mentioned that there was a discussion of those things happening. And so the process is the notice of proposed rulemaking that goes out in the Federal Register, open for public comment for 60 days. And we got that notice yesterday that HIPAA changes are being proposed. Now, this is how this stuff works: is you propose it, they ask for comment of information. That happened this time last year. Now they're publishing, I don't remember how they named it, but this NPRM that open for public comment for 60 days from the date it is officially published in the Federal Register. I don't know what day that will be. And there's a lot of stuff in it. It just came out yesterday afternoon, did a quick review. We're moving that to the next episode so that we can cover that in better detail. But it's out there, folks. There's going to be changes. And guess what?
What?
Nothing for the security rule.
Yeah.
All privacy rule stuff. And it's not HIPAA going away.
You mean Biden's not going to get rid of HIPAA?
Everybody tries.
Every time something happens, every time we have an election, people say
COVID,
the yeah,
election. Doesn't matter. Everybody
yeah.
thinks it's going to be gone. No, it's not. It's your right to privacy. Come on, people. And it's getting worse, which we're about to talk about.
Yep, we are. All right. So, what have we said about medical devices and security?
Yeah. Well, like a year ago, we did this whole bit about all these images out on the internet, like a million of them
Mm-hmm.
that were available on PAC systems. And we talked then about specifically in that imaging sector, if you will, of the healthcare industry. Within that sub part, there are well known problems with security on those devices and those applications.
Right.
Well, guess what?
Why?
Ars Technica posts a big thing. Way GE, it turns out. So if you have any GE imaging equipment, look into this. They use a default password for maintenance
Mm.
that's publicly available.
Well, this gets into risk analysis and vetting vendors and looking into things. Never
Well,
assume.
you ask GE if there's, oh, yeah, we got it. But, you know, this is on GE,
Mm-hmm.
this is on them. And to make it even worse, they're like, well, this is going to be hard for us to patch. And really hard for us to do, which is probably why they hadn't done it. They were just waiting to get caught. There's that balance of what's it going to cost versus how we're going to get caught.
Right.
Um, that's what a lot of people make decisions on. I'm not saying I know they do, but
Yeah.
it's possible that that has been going on at some level, or somebody just didn't tell somebody.
Mm.
Let's just assume whatever it is, you would think, oh my word, let's solve this immediately. No.
Yeah. I think they'll find some person and be like, this is the guy that didn't tell us.
Yeah.
Here's your golden
Under the bus.
parachute. Yeah. Here's your golden parachute as we throw you under the bus.
But the problem is that they don't have a way to roll out like a patch or a fix. They're not sure when they'll do that. But if you take the time to understand that you have a pretty big security vulnerability sitting on your network and call them, they'll do it for you.
Mhm.
But that's how many people know that, other than, the people that read that nerd news and listen to us.
Right.
So we're gonna, try to educate all of our clients and let them know, hey, this is a thing you should evaluate, but you got to call them. You got to call their support and specifically say, I want you to change this, default password thing.
Your call is important to us. Please wait. You are number 125,000 in the queue.
Come on, man.
Yeah, I'm really important to you. All right.
But here's the thing that people don't understand is, let's say an attacker gets into the network, but they can't manage to get into a device, and they find one of those.
Mm.
And this is, hackers will tell you that you can go in and look for a printer and establish like a beachhead on a printer that has a default password. So that's why we always ask about default passwords.
Mm-hmm.
And you can sit there on the printer and watch the traffic and do things. Well, this is the same kind of thing. They can get this level, and they're using it for maintenance. So it's got a lot of power.
Right.
And they can like find that machine in a quick scan. Boom, it's going to flag real quick. Here's the default admin ID. Hop in there and sit and watch the traffic. And from there, I can launch attacks. It's their beachhead.
Mm-hmm.
So that is the concern. And everybody's like, well, it's behind my secure network.
Yeah.
Okay.
Yeah.
Yeah. It's literally a Trojan horse sitting there. So anyway, if you have GE imaging devices, look into this. Post haste.
Yes, you should. Absolutely. Give them a call.
Yeah, and we'll have a link to the article in Ars Technica on the show notes for you.
All right. That's our our special section of the day.
Yes, as HIPAA say, what continues? HIPAA say, breach notifications are required, and we went through this period of alerts about COVID phishing scams, COVID malware, false websites, and then, of course, the big one of a ransomware attacks aimed at healthcare. We've had all of those last X number of months, right?
Right.
So 60 days from where you start hearing about those, you will start seeing announcements of data breaches. And, only a few hundred times do you have to hear there's a data breach things happening before you realize, oh, wait, somebody's going to have to announce those in 60 days.
Yeah.
So sure enough, we're starting to see it.
Yep.
And
I'm a firm believer in however many you see, you can probably multiply that by 100.
Well, at least 10. You know what I'm saying?
Yeah, I'm thinking a bunch. Just
It's
because
possible.
Just because I personally know so many times where people are like, I'll think about it.
And then they never get back to you.
Yeah, we'll get that done. Yeah. And they're not reporting, it's self-reporting. So I mean, I think the number is massively higher.
I know where I've been called about, can you consult with us on this breach? And then I ask them a few questions and I said, well, you got to prepare to notify, blah, blah, blah. And then I never hear back from them and I never see. And, I don't know. I can't track them all down. I don't have the resources to make this podcast work, barely. So,
yeah, I'm having that conversation right now with it's not even a client of mine, but I mean, they hired us to come in to do this piece, but yeah, we're having that conversation now. And it's funny how much time and energy they put into trying to tell you it's not PHI.
There's a lot of effort. Yeah.
I'm like,
when you're spending that much time to do that, it should tell you right away. So we had a big one that Dental Care Alliance down in Florida, which is tons of dentist offices, the ones that it's not going to happen to us. We're very secure. We've been saying for years that, dental is some of the ones that are the least concerned about the things they're supposed to be concerned about.
Yeah.
So they're notifying, this is like a big, management entity where there's all these different practices involved.
Right.
And they're apparently notifying over 1 million patients.
Ooh. That's going to be costly.
Yeah. But you want to talk about costly?
Yes, I do want to talk about costly.
When I saw this, I was like, what?
I know.
So there's
I know.
You got that.
I did a double take. I was like, wait a minute.
What is
surely that can't be right.
I know, and it just gets worse. And I mean, at first I'm like, no way. And then the more you read it, you're like, oh, holy crap. I mean, it's terrifying to read this thing. But the headline was cyber attack cost UVM Medical Center 1.5 million a day. Yeah. A day. They were hit in October and they're still not back, where they are. They haven't confirmed it was one of those ones that were a ransomware attack. They haven't confirmed anything about the attack. They've been talking about the recovery, and they've mentioned that the FBI came in and worked on the investigation. So you have to assume. But here's the bad thing. They got hit on the day that the FBI thing came out. On the day that it came out.
Man.
Yeah. That's just, it's too bad. It's too bad. Sad. What are you going to do?
Yeah.
But this is when you read it, okay. So this is an interview. It's a University of Vermont Medical Center, and the president of some part of it is in this interview. It is a Vermont news organization. Not sure. I don't recall which one off the top of my head. But they were interviewing the president, and they said he said that he called that a back of the envelope number, 1.5 million. And he said, get this though, that's just the cost. It doesn't cover the cost of the system getting back up and running. It doesn't cover any of the recovery things. It covers the cost of the downtime.
Oh man. That's crazy.
I know. I'm like, and he's saying, I mean, so you got to figure it's at least double per day in some cases on some days. You know, other days it's, 2 million, but it's up there. And the thing is this was October 28th. They were hit. And this article was like this week, I want to say. They aren't fully operational yet. Like there's cancer care they can't do yet. And they mention a lot of the imaging services being the ones that they're bringing back on.
Mm-hmm.
I'm just saying, I wonder if they're GE. Don't know. But here's when you know it's bad. When you have a cyber attack and they call in the National Guard. They called in the Vermont National Guard.
Okay.
To help them go around and work with every workstation. Because that's what you got to do in a lot of these cases.
Wow.
Yeah. It can't be good when you have to call the National Guard. I mean, can you imagine? It's just like you're the IT guy. I would like to call the National Guard, bring them in for some IT help.
Well, I mean, we talk all the time about we're all in the middle of a cyber war. Whether you know it or not, you're slap dab in the middle of a cyber war.
Yeah.
I think that's
it's getting worse. The nation state, they said these attacks were nation state attacks. So,
yeah.
And this is one of the things that the hospital, the president that they're interviewing, he had initially predicted it would take days, not weeks, to restore the hospital system. Yeah, and then they're bringing in, let's see, the National Guard to help clean and restore 5,000 workstations and laptops. And by the way, they've had to temporarily furlough or reassign 300 people because they don't have work for them to do because they're so busy recovering. It's like the stuff you can work with doesn't work right now. So we need you to do all of this. But here was the, right in the middle of this article was the thing that I thought was quite, the 1.5 million got my attention, but this is the nugget that I think that everyone should hear. And the quote was, if you told me more than a month after this attack, we still would have functions that weren't normal, I would have bet you that you'd be wrong. We really did not anticipate the scope or the impact the attack had on our system and how far reaching it was. Now, this is where we talk about security risk analysis. And ransomware attack is, critical. That's the kind of damage you need to classify that as destructive, completely to the ground destructive, and then build up from there.
Right.
And clearly he would have bet that you were wrong. How many times is he going to hear that, David?
Yeah. And there's probably somebody that was in IT going to try to tell him. Try to tell him. Yeah.
Security officer, compliance officer.
It's all the time, really, because people, and I'm not saying it happened here, but people tend to fall into that it won't happen to me scenario. Or they'll, they won't think it'll be that bad, or we have things in place or whatever, but they don't test them out, whatever the case might be. But, this article speaks to a lot of things. It speaks to the fact that the costs are almost always a lot more than people anticipate. The time to recover is almost always more than they anticipate.
Right.
It's like everything that you think it's going to be is multiplied by a lot more.
Well, and the breadth, how much it impacts, the width of the damage.
Right.
that it really, you don't realize just how much everything's interconnected until everything that's interconnected gets hit.
Right.
So it's totally, a mess. But I thought that whole thing about I would have bet you were wrong, and started to say, and began by saying, confidently saying days, not weeks. And here they are, almost 2 months out, 6 weeks out when the article, is being talked about. So there you have it. That's, they still have to deal with notifications and all of that other kind of stuff. But in this case, yes, HIPAA says you have to notify, but more importantly, HIPAA says you need to seriously consider the full impact of those threats that you're up against on your security risk analysis. And in today's world in healthcare, if you don't have a security risk analysis that lists ransomware as very likely to occur, if not almost certain, let's call it very likely,
Mm-hmm.
and, actual critical level of damage, so that it is a critically high item on your risk analysis, then you're not doing the HIPAA risk analysis right. I'm
I
just
agree.
saying.
I agree.
Well, at least it's the two of us.
Yeah. And just so the listeners know, we haven't even got into the attacks getting worse in 2021 piece.
I know
yet.
we're about to tell you now. Those are things that are happening in 2020. Now let's tell you why it's going to get worse.
It's like, really? It can get worse? Yes. Yes, it
Potentially a
can.
lot worse. So
Mhm.
first, the thing that I was going to talk about, right, was this report from Black Book, and it's one of those things. I think you have to pay to be a vendor. I don't know the whole deal. There's vendors in there.
Mhm.
It's all about healthcare stuff. They do market research for these vendors, and then tell you how awesome the vendors are that they have done this market research for.
Is it paid market research?
I, that they get paid to do the research. Yes, I'm sure. Anyway, this survey is specifically about cybersecurity and healthcare. And they call it the 2020 State of the Cybersecurity, Industry, Healthcare, something, something, something.
Mm-hmm.
This came out in November. Okay. So very recent. And just hadn't had a chance to cover it. We've been a little busy on our episodes. Here's some nuggets from this report. 73% of health systems, hospitals, and physician organizations report their infrastructure are unprepared to respond to an attack. 73%.
Okay. Yep.
And that's health systems, hospitals, physicians, organizations. Not the big ones, it's all of them. The results estimated 1,500 healthcare providers are vulnerable to data breaches of 500 or more, representing a 300% increase year over year from 2019.
Wow. Mm.
Okay. That 300% increase. So you might want to think things are going to get worse. Then they also surveyed roughly 2,500 security professionals from 705 provider organizations to say, what do you think's going on out there? What makes you, I think they use the term, what is it? Proverbial sitting ducks.
Oh, okay.
96%
Oh.
of these 2,500, 96% of these IT professionals agreed with the sentiments that data attackers are outpacing their medical enterprises, holding providers at a disadvantage in responding to vulnerabilities.
I would worry about the 4% that didn't agree with that.
And of course, we have, we know COVID's made all this worse. COVID is contributing to these insane numbers. And, they do make a point of saying that, there's this huge shift to work from home, and But they also point out that while they did that, they're dealing with all of this. You got the surge in security risk. You got everybody working from home. And then 90% of the employees that shifted to work at home, according to this survey, boy, I'm having a problem today.
Survey.
Survey. Did not receive any updated guidelines or training on the increasing risk of accessing sensitive patient data compromising systems.
Yeah, I mean,
We know that.
Yeah, I've seen that personally where, did you have a work from home policy? And most of the time, no, but some did. But the work from home policy wasn't it wasn't the work from home that they're doing. It was more like,
Right.
well, if this person needs to work from home, they can this way, but not if the entire workforce or most of the workforce, it's very different.
Right. Yeah. And we're all doing telehealth from home and that kind of stuff. So yeah. Further down though, a bit further down, 82% of the information officers and information security officers in Q3, so just finished, agree that the dollars spent currently have not been allocated prior to their tenure effectively. Now, it's not happening under me, it happened under the other guys. Often only spent after there were breaches.
Yep.
And without a full gap assessment of capabilities led by senior management outside of IT.
Yeah, this is another problem we see. When something does happen, they have a knee-jerk response to it, and they just start throwing things at what they perceive to be the problem, because most of the time they're not even addressing the problem. They're addressing the symptom or the specific thing that happened. So,
well, yeah, it's that whole, we've got to show we take this seriously. We're going to invest a bunch of money in it. Boom.
Yeah. And I know we're talking about technology, but oftentimes that's all they do is throw technology at it. And we're like, no.
And that's not where the problem is. We know that.
You can't fix it with just technology.
And here's the last bit of this study before we get to telling you why it's going to get worse. Because we're not even there yet.
I know it's a doom and gloom episode.
Only 14% of hospitals and 6% of physician organizations believe a 2021 assessment of their cybersecurity will show improvement from 2020.
Wow.
26% of provider organizations believe that their cybersecurity position has worsened.
Wow.
As compared to 3% in every other industry.
That's not good. So as the problem increases, your cybersecurity is decreasing.
Yeah.
That's not good.
Well, I mean, COVID is impacting healthcare, and all those people that are worrying about your mask and all this, you know what? It's your healthcare system that this is about.
Mm-hmm.
It's the people that you expect that when you have a heart attack, you can go there and get care and save your life.
Yeah.
It's that simple. It is not about anything else but that need.
I remember when the whole response first started happening to COVID, and everybody, wash your hands and wear the mask and social distance. And, especially the whole wash your hands thing, it was just preaching, wash your hands, hygiene, hygiene, hygiene. I remember saying, maybe even on the podcast, but I was like, if people would take cyber hygiene as serious as they take this, dude, we'd be doing a whole lot better off.
Yeah, but you got to be careful there, because here's the thing. They were taking it serious in March and April, but then they decided it was not necessary. It was inconvenient.
Yeah, which is my point. You see the same flow. It's following the same path. Cyber hygiene, cybersecurity, whatever you want to call it, it's following the same path that people take in real life. They jump on the bandwagon when something happens, right? We're taking this seriously. We're doing all this stuff. And then after a while, it's like, oh, well, it's not as necessary anymore. They drop their level of cybersecurity or security awareness or whatever, hygiene. And it just goes to a lull. and eventually it just goes away altogether. And then you'll even hear people go, well, I'm just not sure that ransomware is even a threat anymore. Is it a real thing? I'm not sure.
It's a hoax.
Yeah, it's
Yeah.
it's
Ask
all
the people
political.
trying to get care, trying to get care in Vermont, if that's it,
Yeah.
But
This whole ransomware thing is just a political thing. But it is.
yeah,
It's kind of
it's the
funny.
same fight,
Yeah, it's funny that it follows the same path, and people still
and
have
it's the same result. We're trying to protect the healthcare
yeah.
infrastructure so they can provide care
Mm-hmm.
to the public.
Yep. It's still about patient care, no matter how you twist
Yeah,
it.
yeah, but that people just don't. You know.
Anyway,
So let's talk about why it's going to get worse.
why, Donna, will it get worse?
Ah, there's a fire in my eye.
Oh, yeah, that's
Fire in the hole. All that kind of stuff. We know that back in 2016, we still see that as a marker of when things really changed and things, cyber attacks really took off and became part of your daily breakfast, right?
Yeah. Big front page news.
That started in 2016. Ironically, that's also when a hacking group called the Shadow Brokers stole the NSA's hacking tools and started publishing them and selling them.
Yeah. Yeah, great.
So
Great
I'm
for
not
hackers.
saying
Yeah,
I'm
great for
not
hacking.
saying they go together. Just maybe want to think about that when we go into the next piece. Now, it's not like, the NSA level of security is way big. They were literally trying to attack because that's their job.
Mm-hmm.
But one of the top cybersecurity vendors, I guess, in the world,
Yeah.
called FireEye. And we're talking tons of governments use them, major companies use them. They're very well known. And they announced this week that they were hit and the hackers stole all of their pen testing tools.
Mm-hmm.
What this means is that these are the people that the governments and the big companies hire to try and see if they can break in.
Right.
They're the ones, you hear on Darknet Diaries interviews and stuff. And, Jack's getting them to tell them some scary stuff that they do to break in, and they have all these tools.
Mm-hmm.
Hackers took those tools.
Oh boy.
Now, the good news, the folks at FireEye, they're being somewhat transparent because they came out and flat out said it, and they didn't try to hide it as soon as possible.
Yeah.
Because the clock's a ticking at this point because you don't know. They believe it was a nation state attack,
right?
But that's it. That's all we know. They've published the tools on GitHub, and 300 things that you can do to what was the countermeasures was the word they used. Countermeasures. 300 countermeasures. And there's also a list of 16 bugs patches that are available that people need to make sure they have. And, frankly, in the statement from the CEO of FireEye, they said, we are not sure if the attacker intends to use our red team tools or to publicly disclose them. Nevertheless, out of an abundance of caution, we've heard that one before. We have developed more than 300 countermeasures for our customers and the community at large to use to minimize the potential impact of the theft of these tools.
Yeah, but we can't get people to update firmware on a product. How are we going to get them to follow 300 different things?
But I mean, again, these are like for security professionals to do.
Yeah.
Not like IT help desk. This is for security professionals
in their spare time.
Which, by the way, one of the things in the Black Book report it went on and on about is the lack of skilled professionals that understand truly how to do security.
Yeah, it's a
And how
problem.
hard it is.
It's
Yeah.
a problem.
Well, yeah, I mean, it's not getting better.
No.
And people were, sounding the alarm about it 2 years ago. We have a potential 3 million shortage coming in like 2021, I think, or 2 is when they said. So here we are.
Yeah.
Shortage is still here.
And it doesn't help that there are so many vendors out there that are even telling the IT community that all you have to do is buy this and do this. It's very similar to the whole HIPAA thing, right? All you have to do is
all you gotta do is
this, just, check the box. But I see that all the time in the cybersecurity piece too. It's like, if you just buy our tool, if you just purchase our stack, if you just do this, and I'm like, okay, but yeah, they know how to run the tools, but they still don't understand the deep parts of cybersecurity. They're not a cybersecurity professional. They just are dabbling in it. And we've talked about that in a previous podcast of how you just need to know where your core information and knowledge stops, and you need to look at, bringing in somebody who understands these things. And it amazes me how many people say, well, I understand forensics, I understand this, I understand that. And then when you start talking to them, it's all stuff that they're outsourcing to somebody who says they got it.
Yeah.
And it's like, golly. Yeah. So
Yeah.
it's a problem.
Yeah.
It's a problem.
Indeed. And it is not going to, I mean, even if you think about going out to third quarter 2021, these 300 countermeasures and 16 patches, just the 16 patches. Let's not even talk about the countermeasures. Let's just talk about the 16 patches.
Right.
What's the likelihood that the vast majority of people who need them today will have them by then?
Not many. Yeah. And then you take the smaller organizations, let's say, they have a break, they have a break fix IT guy or an MSP. They're relying on that IT guy or MSP to know this.
Yes.
And to do something with it. Otherwise, it's not going to happen. Then that goes right back to the conversation we just had. The IT guy, the MSP probably can't do these things, or they don't have time to do these things. And so they won't get done. And so all these smaller organizations, even the medium-sized organizations, possibly it's never going to happen.
And we may not know openly what they're doing with these tools. It depends a lot on if they figure out what the nation state is, right? If it's, North Korea, they're well known for using the tools and selling them because they need the money. If it's Iran, or as they say in the South, Iran, Iran and Iraq. But if it's in the Middle East, I mean, the Iranians are a big problem for us. And I don't think people really realize what's going on in that cyber war.
Right.
And so who knows? And that FireEye has done so much with governments. You would think that they use these tools and then they fix those problems with their clients.
Right.
Okay. And then they make sure their clients have it fixed. What about everybody else?
They probably come out and said, well, I mean, I know they didn't do this, but it would be like, if you're a client of ours, you're good. Everybody else, you're in trouble.
Yeah. So we don't know. We may not know. Shadow brokers came out and said, we're selling this. That doesn't mean everybody else will, and they can still sell it. And they could, create their own. Here's what I envision is they'll take that, because those are red team tools. They're designed to find ways into networks, and they will create a red team. And that red team, we just talked about, with Eric about what if, well, going back to the Vermont thing, what if that happened in a group, a region where all the healthcare providers were hit the same way in that region, and it was a COVID hotspot? Can you even comprehend the impact that would have?
Yeah, it'd be a mess.
And they they weren't in a COVID hotspot at the time. They only had like 6 COVID patients when this happened. But imagine if your ICU is full, like a lot of places. I'm watching the map, monitoring hospitalization. That's the thing I've been monitoring all along. Hospitalization is what matters, is the impact to what we do. You know, you have a ton of sick people, but if they're all in the hospital, that's when it really drags the healthcare system down.
Mm-hmm.
And our healthcare system is not designed for this. It is not built for this at all. It's built to be full of patients that are paying for things, specialized surgeries, elective things, not emergency things.
Mm-hmm.
And so it's just crushing to so much. And you add that the University of Vermont, you add in the 1.5 million per day for 6 weeks. Anyway, so
that's almost as much as you make.
Maybe before I die. But it in what he was talking about, it was that whole thing of what is the intent of these attackers, and trying to stay ahead of them is almost impossible. Everything we've just gone through tells you. And then let's not forget the massive Equifax breach occurred because something wasn't patched, and it was like 4 months behind being patched.
Yep. Yeah, it's gonna be a mess.
Yeah. So they could take and do the nation state stuff, but they could also start selling the things they find that they decide they don't want. And that's the other parts we covered with Eric. So they're aimed potentially at shutting down an entire region, healthcare during a COVID outbreak. That's one thing. And there would be great deal of value in both criminal enterprise as well as nation state to hurt the United States. Then you have, well, we found our way into this. We don't see it gives us value towards our intent. So now we're going to sell it to somebody else who will then package it up and resell it, and package it up and resell it, so that those people are hit by just the criminal enterprise.
Yeah. Yep. You may even see the cyber attack as a service offer some of these things.
Yeah. I think that there's a great possibility that, they're already hired, cyber assassins, so to speak. There are hired guns out there all over the place. I mean, if you wanted to make sure that someone's life became miserable, you could hire somebody to use social engineering and these hacking kind of tools and make them disappear, make them become somebody they're not. I mean, you could do so many things, and you could just hire somebody to do it.
And as you described that, most listeners had somebody in mind.
I know you did, and I know who it was.
Let's see. That could be useful here.
So it is absolutely impossible to even imagine that all of these things that we were talking about, up to all of those things, came out and happened before this thing. So I can't imagine. We were already we knew going in it was going to be worse.
Right.
But the potential this has, because there's so much unknown and there's so much capability, it's pretty, that's why buckle up.
Yeah. Buckle up, Buttercup.
Yeah,
it's a rough ride.
It was like what was it? The full of potholes. 2020, we were riding on a road full of potholes. Right? And that will feel like a freshly paved street compared to what 2021 could become.
Thanks, Donna. Thanks. Just as I think I'm putting all the bad behind me, you tell me the worst is yet to come.
I know. I'm always one of those ones, plan for the worst hope for the best. So you have to plan for 2021 to be worse than 2020. Hopefully it's an anomaly, not a new way of life.
Right. Yep. So
I mean, yes, we know we're changed forever,
mhm.
but how much is that change? You know, let's not make it where every day somebody's shut down completely.
Yeah. I wonder how many people are going, we're going back to pencil and paper.
And you try that, go ahead, try it.
Yeah.
You know?
I've had people say that to me. We're just going
Yeah.
back to paper charts. I'm like,
Why don't we do this? I was like, go ahead, try it. Just
Yeah.
try it. Yeah. Particularly in healthcare, how you gonna get paid? You know,
cash?
because that's it. And how many
Apple pie.
patients can actually pay that way? I mean, that's the way you used to get paid, you know, the local doctors and stuff.
Mm-hmm. Be like, can you just bring me an apple pie next time you in town? We'll call it even. It's funny because we just had a doctor pass away here in town, and he was probably in his 90s. And so many people coming out of the woodwork, and they're like, yeah, when I was a kid, and these people are like 60 or 70. When I was a kid, he treated our whole family and didn't charge us anything. And, we would just bring him cookies or, whatever. There's all these little, bartering things that they would do just because it was a small town, doctor.
Mm-hmm.
But no, I don't think that's the thing anymore.
No, not so much. I mean, it is, but I don't think HIPAA impacted it as much as, insurance impacted it.
Right.
So there's a lot of things. I remember I went to a doctor and it was on a street. Now, the street was basically just a paved section in my small town of Dahlonega back then. Tiny little street. I mean, like you kind of had to inch over to go past each other kind of thing. And there was the doctor's office. And you walked out of the doctor's office and walked across this little street to the pharmacy. So you go see Dr. Woodward and then go over to Pete's. Pete was the pharmacist. Everybody knew Pete.
Yeah.
So, but yeah, it's a different world by far, and the changes in the world today are impacted by technology. So they're rapid. And I think that's a lot of the things that people miss. Yep. So there you go. We're closing out 2020 right here.
Yeah, I'm done. I don't want to hear no more.
Yeah. We're just gonna keep the faith.
Yeah,
plan for the best, and plan for the worst, and hope for the best.
Plan for the best, hope for the worst. I don't know about
that's
you,
what too many people do.
I'm going to buy some toilet paper.
Yeah.
I've learned that if there's a ransomware attack, everybody has to use the bathroom. Maybe buy some alcohol too. I'm not talking about the rubbing kind.
The brown water that comes in a bottle.
Yeah,
that's what I like.
Yep. So anyway, I'm glad 2020 is over. At least not officially, but officially for us, it's over.
Yeah, who knows what we'll be talking about in 2 weeks.
Yeah.
January 1st is 2 weeks from the time this comes out. So
wow.
Crazy. Hard to believe, but really glad to just put a pin in it. Put a fork in it. It's done.
Put a fork in it. It's burnt.
Oh, yeah.
Slap burnt.
Yeah, you probably couldn't get a fork in it.
No, can't get a fork in it.
It's all a brick.
All right, folks, that's our show for today. Remember to follow us and share us out on your favorite social media site. Check us out on YouTube, and you can share that out so you can see all the beauty that comes from the camera. We have to do a lot of makeup before we get on here. Make sure you rate us on our podcast. And as always, we need your help to spread the word. Give us reviews. We love them. Absolutely love the reviews. Keep them coming. And I think there's still a push to get me to wear a dress. So if you want to donate to that cause, let us know. And don't forget the HIPAA boot camp at thehippabootcamp.com. It's coming up in February. You need to get signed up today. So for Donna and myself, remember the HIPAA is not about compliance. It's about patient care.